All right. Read the stem for me, please. Anyone? Any female, please. Any female, please.
Young female patient with right upper quadrant pain, which was aggravated by a fatty meal. Vital
Yes.
signs on the chart are normal.
Yes. Dr. Farial, can you tell me what are the 5 F of gallbladder stone?
Female, fatty, 40, fertile.
Yes. Female, 40. What?
Fatty,
Sorry.
fat,
Fatty. Yes.
fertile,
Fatty. Fertile.
Fair,
Yes.
fair,
fertile,
Fair.
Fluid.
Yes.
fair.
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 1, 2, 3, 4,
fair.
5. Yes, that's the
Yeah.
5. Okay. So I made it like something very funny. A fair fatty female in her 40 became fertile with the gallstones. So yes, very good. Very good, Farial. All right. So the thing is, you have to think about the stem here. Young female patient, right upper quadrant pain, and it is aggravated by fatty meal. So it goes in which aspect? Of course, in the gallstones, right? So the patient is
Yeah.
having some kind of biliary colic. Maybe there is a gallstone. What else we can think about? Maybe the patient have the peptic ulcer disease and it aggravated. Okay, so the patient is having some kind of pain. Also, maybe these two, maybe this is not closely related, but you have to give some kind of disease, right? So you can say right renal colic or right lobe pneumonia. This can cause also some kind of right upper quadrant pain. Okay, that's why these two. But mainly, this is your main diagnosis. Okay, and the gallstones. Okay, so now let's go deep into it. Okay, what are the most common types of gallstone?
Cholesterol, stones, and pigmented. Cholesterol, pigmented, and mixed.
Okay, most common 2 types are
Cholesterol and pigmented.
yes. So one is our cholesterol, and another one is the pigment, right? So what is the function of bile? What is the function of bile?
Digestion of fat.
Yes.
of fat and fat soluble vitamin.
Digestion,
Yeah.
firstly, digestion of the and absorption. Yes, by forming the micelles. Remember?
Yes.
Yes.
Okay. So think, if you eat a lots of fats, okay,
Fat.
that means the cholesterol level of cholesterol is so high.
Will be high.
Okay, the cholesterol level is so high that it cannot be broken down via the bile. Okay, this is known as the solubilizing capacity of the bile. Okay, this is known as the solubilizing capacity of the bile. So the cholesterol will be super saturated, right?
Saturation.
Okay, simply, if you have a lots of cholesterol in your food and the bile is in the same manner, okay, it cannot cause the breakdown of the cholesterol. That means the solubilizing capacity of the bile is less and the cholesterol concentration exceeds its limit. Okay, so then there will be supersaturation of this cholesterol. That's the first thing, super saturation. Okay, next, because the bile cannot break in the cholesterol, so of course it will got super saturated. Next, if you have less motility, into the gallbladder, what it will cause? There will be lack of bile secretion, right?
Yes.
So hypomotility
Motility.
of the gallbladder. There is lack of bile. The same thing. Okay. If there is a supersaturation, then it can initiate the crystal formation. Okay. What crystal? The cholesterol crystal.
Cholesterol
Okay.
crystal.
This is known as the cholesterol crystal nucleation. Okay. Cholesterol crystal nucleation. Okay. Now, if there is a cholesterol crystal nucleation and the gallbladder is secreting more mucus. Okay, more mucus. The function of the mucus will cause the aggregation of this crystal nucleation. Okay,
Yes.
so if there is a gallbladder, what? If there is a hypersecretion of the gallbladder mucus.
আমারে কইছে তো আজকে তো আমার গেছে কত 6টা 6:30টার সময়
Excuse me, Dr. iPad, can you mute yourself?
6:30 পর্যন্ত থাকছে এখানে এ বই আর হইছে আমার কিছুক্ষণ জ্ঞান জ্ঞান দিল আমার পড়া দরকার পড়ালেখা
Excuse me.
বুকে
Hello.
কানে টাইট দেওয়া দরকার হ্যাঁ কিছু ভালো কথা কইছে ফাউন্ডেশনটা করা দরকার
Hello. I'm sorry. Really sorry about that. Okay. All right. So yes, where I was. Okay. So if there is a hypersecretion of this mucus from the gallbladder, it will cause the nucleation, the trapping of this cholesterol nucleus, okay, in a hole, and overall, all of those processes can cause the formation of the cholesterol stone. Is it clear how there will be cholesterol stone formation?
So what is the difference between supersaturation and crystal nucleation?
Okay, for the formation of the crystals, you have to have this cholesterol that has been aggregated in a simple place, right? Without the supersaturation of this cholesterol, you cannot be formed into a single nucleation or a single crystals. Think this outer shell is your nucleation. Okay, this outer shell is your nucleation, and the supersaturated cholesterol are these dots. Okay, so if there is no supersaturated cholesterol, so of course the overall nucleation of crystal nucleations will be less, because you don't have that supersaturated cholesterols inside of your gallbladder. Clear? Is it clear? Not clear?
Yes.
Okay.
Yes. Clear.
All right. Next is our pigment stone. Okay. So pigment stone, when we can have those pigments?
Yeah, but because of the hemolysis is most common, no?
Yes, mainly if there is a unconjugated
Hyperbilirubinemia.
Yes, in that case also, if there is a overproduction or elevated levels of this unconjugated bilirubin, this can cause some kind of formation of this pigment stones. Okay, where we can have this increased level of unconjugated bilirubin? So simply remember in previously, yes, the hemolytic anemia patient. Okay, also maybe we can have this in ascending sclerosing cholangitis patient. Okay, because of the bacterial contamination of the biliary tree, because of the infection of that area. Okay, we can have that as well. All right, so simply the pigment stones mainly will have if it is increased, the levels of unconjugated bilirubin, it can cause the formation of these pigment stones. Okay, so now what are the complications as a whole in case of the gallstones? What are the complications? Okay, so first thing first,
Yeah.
it can be silent.
Yes.
Okay, it can be silent,
Asymptomatic.
and the patient is symptom free.
Symptom free.
Next, this is very important, and you have to think this very think. Okay, in impaction. Okay, so impaction, there are two things that can happen. Okay, one is called chemical yes, cholecystitis, and another one is empyema.
Gallbladder.
Okay, how chemical cholecystitis? So think, if the impaction within the gallbladder with the stone, it okay, let's think like this. Gallbladder is full with bile.
Bile.
Okay, then
Yeah.
there is impaction. The bile cannot go out. Okay, the bile cannot go out. So within the impacted gallbladder, what is left? The bile, right? So the
Yes.
bile is impacted. Now, after a while, all the water, remember the constituents of the
Reabsorbed.
bile, there are some water. So all the water will be reabsorbed. Because why? Because there are some epithelium, okay, within the
Yeah.
gallbladder epithelium. So the water will be reabsorbed. So what will left? There are,
Bile salt and bile acid.
yes, the bile salts and the acids. These are irritant.
Yeah.
These are irritant to
Yeah.
the epithelium, and this can cause the chemical cholecystitis to the patient. Okay, that's number one. Second, you have to think the gallbladder is empty. Okay,
Yeah.
the gallbladder is empty. There is no bile inside, and there is a stone. There is a stone impaction. Okay, so if there is a stone impaction while there is an empty gallbladder, but there is a continuous secretion of the mucus from the gallbladder
Yes.
epithelium itself. So there is what? Only mucus within the gallbladder. But as I said, when there is stasis, there is increased chance of infection. Okay. So the
Yes.
mucus got impacted. If it gets infection, then there will be formation of what?
Abscess.
The
Gallbladder abscess.
it's called mucocele.
Yeah.
Mucocele. Okay, mucocele.
Yeah.
Normally, the impaction, if there is a mucus infection, is known as mucocele. And if it is got infected, then from this mucocele, it will be formed as the empyema of the gallbladder.
Gallbladder.
Clear about this, everyone? How
Yeah.
the infection can cause the chemical cholecystitis and the empyema of the gallbladder? You have to know this by your heart. Is it clear?
Yes.
Dr. Fayaz, Dr. Fatema, Dr. Farial, Dr. Adnan.
Yes, sir.
Yes, sir.
Yes,
Yes.
yes.
Yes,
Yeah.
sir.
Very
Yes,
good.
sir.
Very good.
Clear,
Very
sir.
good. Okay. Next is all we know, the choledocholithiasis. Okay. Simply, if the gallstones migrate into the common bile duct, okay, it will cause what? Obstruction. It will cause the obstruction, right? So the patient will
Yes.
have what? Obstructive
Jaundice.
jaundice. Okay, also there can be some cause pain as well. Okay, if there is obstruction, it can cause the ascending cholangitis. Also it can cause acute pancreatitis as well. Remember, the
Yes.
choledocholitis is the cause of acute pancreatitis.
Acute
Remember,
pancreatitis.
I mentioned this in the acute pancreatitis, how the gallstone can cause the acute pancreatitis, if you can remember that. All right.
Yes.
So it is the stone is impacting over the common bile duct. Okay. If the stone got so big, okay, it is so big and it is impacted in the cystic duct or the Hartmann's pouch. Okay. So it is compressing over the maybe the common hepatic duct itself. Okay. Maybe. Okay. And also it can cause some kind of obstructive jaundice as well. What is
Jaundice.
the
Yeah.
problem? What is the name of this condition or syndrome?
Meningitis syndrome.
Yes,
Meningitis.
the
Meningitis syndrome.
Meningitis syndrome. Okay, simply
Syndrome.
the stone is too big. Okay, the stone is too big, and it is compressing over those areas, and it can cause some kind of obstructive jaundice as well. Okay, let's think. Maybe in case of Meningitis syndrome or not, maybe individual any kind of stone, what it can do is, but normally the stone size is normal in that case as well. Normally what it can do, if there is an impaction, okay, maybe in the Hartmann pouch or somewhere else, anywhere, if there is an impaction within the gallbladder as well, it can cause some compression effect, right? Compression effect. And
Yeah.
after sometimes, if there is a compression, that means there will be some kind of ischemic necrosis to that area, and it can cause ulceration. If there is an ulceration for a long period of time, so it can cause what? Fistula.
Erosion, fistula formation.
Yes, fistulation. Okay, so think if that large stone goes into the ileum, okay, and there is some impaction as well of the small bowel and causing some distal ileus, okay, distal ileus. This syndrome known as gallstone
ileus.
Yes.
Yes.
Gallstone ileus. Okay, from the part A, can anyone tell me what is the management of this gallstone ileus? I know everyone gone through that hepatobiliary system very well, I guess.
Proximal
Yes, yes.
enterotomy, removal of
Yes,
the stone,
yes.
and leave the gallbladder alone.
Excellent.
Don't do cholesterol.
Excellent. Yes, we did in the part A. We have to dissect above
Yeah.
the site of the impaction, side of the impaction, and we squeeze the stone, okay, out,
Stone.
and we leave the gallbladder in situ. That's what we did in part A. Yes, and that's what we have to go for as well. Okay. All right. What are the normal